difficulties here. The Medicare Minutes is actually an educational program. Okay. Nicole just shows me stop, wait, hold on.
All right, so we're live now with our Medicare Minutes. So I'm Nicole Bashiri, Family Consumer Sciences Extension Agent in Bath County. And Sasia is going to introduce herself, and then she's going to go through with her program.
All right. Well, thanks, Nicole. After the little startup difficulties here in our virtual world, in our new virtual world, I just wanted to, hey, thank you so much, Nicole. I appreciate it. And too bad we're not able to all meet for our lunch and learn. So this is a new way of going, and I'm looking forward presenting you here a couple ideas in our Medicare Minutes program. So the Medicare Minute program is an educational presentation, and that will be given every month here at the Ag Center, or right now under our situations here virtually. And I'm trying to help folks with their benefits and get maybe additional benefits and help with some coverage problems, so you really get some help with your healthcare needs. Pretty much save money and be healthy. Please ask questions if you do have some. This program is for you and only for you. And I hope the information about the Medicare Savings Program today will give you some additional information. This program is, by the way, developed by the Medicare Rights Center. And we have a little visitor here too. Shauna is here too, watching. I'm Zasia Hollenberg, your insurance lady here locally in Owingsville, and I'm a broker, which means I carry pretty much all the important carriers here for the state of Kentucky. Again, if you have questions, please type them in or raise your hand and we'll address that. So the program today is going to be about the Medicare Savings Program. And just to start out a little bit, there are several different programs out there to help with healthcare costs. One is Medicaid. Then there is the Medicare Savings Program. And there are also low-cost health centers and clinics. And for example, here in Bath County, it is the New Hope Clinic. They're normally open on Thursdays at no cost. So today we will focus strictly on the Medicare Savings Program. There are also, and this is another scenario because we're going to cross in a little bit into this, there are also other programs available for prescription drug cost assistance. The first one is, this is called Extra Help or Low Income Subsidy, LIS. There is a state pharmaceutical assistance program, charity programs, patient assistance programs, prescription drug discount programs, for example, the Kroger program, or what a lot of people know is GoodRx. And then there are safety net providers. So these are actually all options for you out there where you can tap in. All of these have certain eligibility requirements, but again, today it's the Medicare Savings Program. So the Medicare Savings Program is actually also known as a Medicare buy-in program or a Medicare premium program. And it helps to pay your Medicare premiums. It helps to pay deductibles, copays, also the copayments for Part A and Part B, but also your Medicare premiums, the $144.60. So there are three main programs available. Each have different eligibilities and benefits. The first one we're going to cover is the QMB program, that is Qualified Medicare Beneficiaries. That is depending on your monthly income. And again, all these numbers really depend on the state. We're here focusing obviously on Kentucky. If you listen from another state, it might be different. The monthly income should be at or below 100% of the federal poverty level. And that would be in numbers, which is easier. $1,063 if you're single, or $1,437 if you're married. So if your income for yourself or if you are married is in this range, then, and you're gonna be approved for this program will then take care of your Part A hospital deductible, which is $1,408 per benefit period. The Part A hospital copays, the SMF copays. So these are skilled nursing facility copays. After 21 days, it's $176 daily. The monthly premium for Part A, which most of you don't pay. There are a few cases where this is going to be a problem, but most of the folks I normally take care of don't have to worry about it. The Part B annual deductible of $198. The Part B monthly premium, that is what a lot of people are really benefiting from before it's $144.60, which they don't have to worry about it. And then obviously the 20% coinsurance for Part B. The next group would be, it's called SLMB, Specified Low Income Medicare Beneficiaries. That income level would be, if you're single, $1,276, or if you're married, $1,724. When you're qualified for this, the monthly premium will be taken care of $144.60. By the way, I did put the flyer with all these numbers, so you don't have to remember all these, on a PDF file in the file section of this event on Facebook. The third group is, it is a qualifying individual program, also QI called. Here, if you are under $1,436 if you're single, or $1,940 if you're married, the Medicare Part B premium of $144.60 will be paid for. Now, could you qualify for this Medicare Savings Program? First of all, you must have Part A. There are certain income and asset guidelines, and they depend really on the state. If you do not have Part A, there are some exceptions to the rule. If you're eligible for QMB, so if your income is under a certain limit, the state actually might pick up your Part A premium and enroll you in Part A, and it's called enrolling in conditional Part A. Typically that happens sometime during the spring, and then you will be eligible for Part A in July. The income and asset limits, that is something that comes on top of your monthly income. So if you have any resources, and this is savings account, checkings account, stocks, bonds, mutual funds, retirement accounts, or real estate which you're renting out, your resources, if you're single, cannot exceed $7,860, or if you're married, $11,800. I know most of us here would not fall under this, but I have seen some cases where the monthly income was very low, but there were assets, and then the qualifications were not there. So the exceptions for the resources here are your primary house, so the house where you live in there, that will not be counted as assets. One car, household goods, wedding or engagement rings, burial spaces, burial funds up to $1,500 per person, or life insurance with cash value of less than $1,500. If you do have a life insurance with more than 1,500 cash value, you could be doing one thing. You could actually find somebody else, like a family member, who would be the owner of the policy, and then this cash value would not count against you. If you have questions about these things, please give me a call. I will blend in my number at the end of the session again. So in all states, the following income is actually not counted: the first $20 of your income, the first $65 of your monthly wages in case you are working, half of your monthly wages after your $65 is deducted, any food stamps or nutritional assistance program supports. How can you apply for Medicare Savings Programs? There are several options, and I will tell you right now, certain at this point, due to the situation where we are in, are probably a little difficult. The first one is online. I can help you with that. That's not a problem at all. You can give me a call. I walk you through the process. Even if you're not online, I can help you with that. Through mail, if you do it through mail, make sure you have it so you can track it, because these things can get lost. Personal appointment at the food stamp office, which is obviously right now not possible, and then community health centers. So for right now, the safest bet is online or through mail. So if you think you are in these brackets and these financial brackets, do me a favor and give me a call, and then let's see if we can, I always say, stick it to the wall and see what happens. Once we submitted the application, they will probably come back with certain documentation requirements, and that is your Social Security card, your Medicare card, your birth certificate or passport or green card, a proof of your address, which can be done through your electric bill or your phone bill, your proof of your income, which is your Social Security awards letter, your income tax return or pay stubs, and then you will have to prove your information about your assets. And that would be possible through bank statements. Typically, they are requiring the last 2 months of bank statements, stock certificates, and life insurance policies, or a letter from the life insurance company stating what your cash value is. So these informations, they will be required. Normally, and again, these are different times, normally, you will get a letter within 45 days. I have seen it longer. I've seen it up to 2 months. But in this time frame, normally you should be able to get a letter stating, yes, you were approved. And what it normally states on there, it says you're denied for Medicaid. But then on the second part of the letter, it states what level of Medicare Savings Programs you were approved. What is very important, and a lot of people are forgetting about that, you do have to renew yearly. So you have to go through this process every year so you're not losing these benefits. The other one would be that you get denied, and you do have an option there to say, hey, listen, let's look at the paper numbers again. Okay. Here are some areas which is important, is beneficial for you when you're having QMB, when you were approved for QMB. The providers must accept Medicare payments and QMB payment as a full payment. Okay. Things can come up a little bit. What I'm seeing quite a bit is that the providers are doing some improper billing. That can happen. Here are two options. One is you have QMB and Original Medicare. No bills for Medicare covered services from either provider or non-participating providers. Or if you have QMB and a Medicare Advantage plan, no bills for plan covered services or in network providers. You might have the need for referrals or prior authorizations depending on what the specific insurance company requires. Okay. Now, original Medicare and Medicare Advantage providers who do not accept Medicaid cannot bill you. You can be billed though if you have a Medicare Advantage plan and you do see a provider outside the network. If you do have Original Medicare and see an opt-out provider, and you need to watch out that you cannot waive these protections and pay Medicare cost sharing. So once you're approved in this program, you will have to stay with that program. You cannot go outside the program. And so we're at the end. Let me know if you have any questions. More than glad also to answer the questions over the phone. You can type it into the comment boxes on Facebook. My phone number is 859-294-7490. And again, I'm local here. I'm your insurance lady here in Owensville, Kentucky. Thank you so much. And thank you, Nicole. I appreciate it. And thank you, Shauna. Hi. It's a different way of working, no question about it. But all right. Thank you, guys.
Yes, so like Sasi said, she's done this at our extension office once. So we did it in February, and this is the second one in March. So each month it is a national program for Medicare information and education. So we're planning on still doing it every month for the rest of this year, probably not in November or December. So if you have any further information you want, specific questions to ask Sasia, or just some things that maybe she can go over in the next one for April, we will see where we are, if we have to do this virtually or at the extension office. And hopefully you will have some questions. We don't currently have any questions on Facebook, but you're more than welcome to leave us some questions so that she can answer them. So if you have any further information, questions, concerns, you can contact Sasia directly, or you can contact us at the extension office. So thank you, and we will see you soon.
Thank you, guys. Bye.